Hi, I am Dr. Reddy. Today I am going to talk to you about a condition or disease that is very common but often undiagnosed because it is silent, which means it may not give you any symptoms. This disease is called non-alcoholic fatty liver disease, or more simply, fatty liver. It is seen in people who do not drink alcohol, but their livers resemble that of a person who is an alcoholic. This condition is more common than you might think. In fact, 25% of people in the United States are affected by it, and probably even more are undiagnosed. So there is a good chance you might have it. The worst part is many doctors do not know how to treat this disease, let alone check for it routinely. With all the medical problems we see today, including diabetes, heart disease, obesity, and some cancers, I believe that fatty liver disease has something to do with all of them. Have you heard the saying, "All roads lead to Rome"? It is an old idiomatic expression which explains that many different routes would lead to the same goal. It is based on the fact that the Roman Empire's road system is designed in such a way that all of its roads radiate from one source, which is the capital. Fatty liver disease is exactly like Rome. Most, if not all, disease processes emanate from fatty liver. So if you have diabetes, heart disease, obesity, or other diseases, you also have fatty liver. And the only way to cure all these conditions is to reverse your fatty liver. I say let's take a crack at it today and learn everything about fatty liver disease and how to reverse it. If you have fatty liver, what does it mean? It means that your liver cells are full of fat. When the liver cells are stuffed with fat, it would not function normally, and that is when all the problems start to happen. Your cholesterol starts to go up, your blood pressure becomes elevated, your fasting blood sugar goes up, you become insulin resistant. After that, you become leptin resistant and you start gaining weight. Then you become a diabetic, and now you are at risk for developing all the diabetic complications. All of these happen when you have fatty liver. If fatty liver is left untreated, it will lead to fibrosis or inflammation and eventually end up with cirrhosis or scarring of the liver. By then, you would need a liver transplant or otherwise die a miserable death. How did fat get into your liver cells? What have you been doing all this time that is making your liver fatty? If you consume fat in your diet, will it make your liver fatty? The answer is no. Then what should you eat in order to have a fatty liver? The answer is sugar. Every time you eat sugar, sugar from the gut enters your bloodstream and then goes directly to the liver. Once it gets into the liver, it is converted into fat and stored as fat in the liver cells. The more sugar you eat, the more fat gets stored in the liver and the more fatty the liver becomes. The other cause for fatty liver is when fat in other parts of your body starts releasing free fatty acids. These fatty acids get transported to the liver so that they can be converted into a different form in which they are easily eliminated. But when the liver is not functioning properly, it is unable to change these free fatty acids. As a result, the free fatty acids get stored as fat instead, thus making the liver more fatty. Most of the time, doctors do not check for fatty liver because they do not know what to do with it. There is no medication available out there that we can prescribe to treat fatty liver. Some doctors may screen you for fatty liver and may be brave enough to advise you on how to reverse your fatty liver. I cringe every time I hear their advice. Most doctors will advise you to go on a diet and exercise. So when you press them hard on saying what diet to go on, they will say eat lots of fruits and vegetables and exercise. When you go back and ask the question, what do fruits give you? Fruits give you sugar. And does sugar help you worsening your fatty liver? The answer is yes. Most doctors will tell you, cut your calories, cut your portion size, exercise regularly. Well, if you cut your calories, will you change or reverse fatty liver? The answer is no. If you exercise regularly, will it help reversing fatty liver if you do not change your diet? The answer is no. If you cut your portion sizes and continue to eat sugar and fruits, will you reverse fatty liver? The answer is no. Some of the physicians are telling their patients to consume at least 1 to 2 glasses of wine every day in order to protect the heart. The answer is simple. What is alcohol? Does alcohol cause fatty liver? The answer is yes. If you consume 1 to 2 glasses of wine every day, is that going to contribute to causing fatty liver? The answer is yes. Even if you do not drink alcohol, can you have fatty liver? The answer is yes. How can a person have fatty liver if he or she does not consume alcohol? If you consume vinegar every day, vinegar comes from alcohol, alcohol comes from sugar, and vinegar is also responsible for fatty liver. Well, I do not consume vinegar. What else can I consume to cause fatty liver? The answer is simple. Honey, agave nectar. These two are notorious in causing fatty liver. What else can cause fatty liver? High fructose corn syrup in the form of tonic water or anything that has got high fructose corn syrup, that can also lead to fatty liver. So at the end of the day, remember, if you're consuming sugar, is that going to start the fatty liver process? The answer is yes. Does sugar, once it enters the bloodstream, enter only the liver? Yes. Does it go anywhere else? No. Only the cell that can process sugar is liver. And liver basically takes sugar and converts into fat and stores it as fat in the liver, and that's how you continue to form fatty liver the more sugar you consume. There are so many other misconceptions or advices which are given to people about fatty liver and how to reverse it. The answer is very simple. Can fatty liver be reversed? The answer is yes. How long does it take to reverse fatty liver? In less than 30 to 90 days. What should I do? Change the diet. What else can I do? Exercise. Can I exercise and not change my diet? The answer is no. You have to change your diet first and exercise. Are there any medications I can take to reverse fatty liver? At the present time, the answer is no. We have a program which teaches you what to eat and what not to eat and why. Once you understand what to eat and what not to eat, and once you understand what causes fatty liver, you are able to easily reverse fatty liver. If you reverse fatty liver and make your liver skinny, then what happens? Your problems subside, especially the problems related to diabetes, high blood pressure, high triglycerides, high cholesterol, inflammation, increased ferritin level, insulin resistance, metabolic syndrome, and leptin resistance.